Hello everyone and welcome to another episode of McCullum Mondays. Once again I have Dr. Yetta McCullum.
Hello.
And today we will be talking about peri-implantitis. So what is that?
Peri-implantitis is inflammation around an implant. Just like periodontitis is inflammation around a tooth that causes the loss of bone and potentially the loss of a tooth, the same thing can happen around an implant.
So how does a patient, get peri-implantitis?
That's a very good question, and there's a lot of research out here that's showing multiple potential reasons. One of them is plaque calculus, just like with the tooth. One of them is a foreign body reaction, like you're rejecting the implant, like your body just doesn't like this metal. Genetics, like if you've lost teeth because of periodontal disease, you're at increased risk for having peri-implantitis. That's pretty much been shown. So there's a lot of potential reasons. Excess cement was thought to be one of the primary reasons for peri-implantitis, so now we are moving toward screw retained crowns on these implants. Occlusal trauma, if you're diabetic or if you smoke or if you have certain medications on board. So there's multiple potential reasons. Just like there's multiple reasons why people have periodontitis, there could be multiple reasons why you have peri-implantitis also.
Okay. So what kind of symptoms do patients have when they have peri-implantitis?
Similar to periodontitis or gingivitis, bleeding, swelling, but a lot of times the patient doesn't even know what's happening. A lot of times you're relying on the dentist or the hygienist to tell you that there's a problem around an implant. You know, the metal has no nerve, so it's not like you're going to have a sensitive tooth because of bone loss. So a lot of times it's the dentist that is telling the patient that they have this problem.
And what's the treatment for peri-implantitis?
Well, there's a couple of different options. Early detection, routine dental care, routine cleanings to prevent it in the first place. There's non-surgical and surgical options for treating it. Just depends on how severe the situation is. And then talking with the patient about the different options. You can use the same options we have for treating teeth. You can do bone grafts. You can do laser treatments. Again, there are a couple of different options. You could always remove the implant, just like people remove their teeth, and just start all over. So there are a couple of ways it can be treated.
Okay. And what questions should patients ask the dentist prior to getting a tooth removed and then an implant placed?
They need to be asking how many options do I have for keeping my teeth, first of all, and is this absolutely necessary to have my tooth removed? Because it's much easier to treat a tooth than it is an implant. And so you just need to make sure you've been given the information on, number one, how to save your tooth. If you've just decided it just can't be kept, then the dentist needs to explain the different options for the implant, peri-implantitis, how long they think that implant's going to last, what is the follow-up care after that implant is placed, is there going to be a need for a night guard and occlusal guard to protect the implant and to protect the bite. Implants were originally started on an older population that had no teeth at all, and their dentures would rest on these implants. And now you're starting to get implants on younger people, replacing one or two teeth, so it's a whole different situation. So you just need to really find out from your dentist how they manage their patients with implants.
Very good. Because a lot of patients think once they get an implant, they're good forever.
And that's not the case.
Not the case.
Not the case, no. Save your teeth.
Hello.